We keep hearing about the HPV vaccine in the news all the time. Often we don't realize how important it is. We ignore it and move on. Let me share some numbers with you. If you are a sexually active woman, your chances of getting infected with HPV in your lifetime is around 85%. And if you're a man, your chances are even higher, almost 90%. 1 in 3 men worldwide are infected with HPV right now. Most of these infections are not serious, but some of them can turn into cancer. And cervical cancer is not the only cancer caused by HPV. It can cause cancer of the mouth and throat, penis, vagina, vulva, and the anal canal. It can cause warts in private parts that can be painful and bleed. The good news is that all of these can be prevented with a simple vaccine. So, what is the HPV vaccine? HPV vaccine is a subunit vaccine. It does not contain the virus. It contains virus-like particles. These look like the virus but cannot cause infection. They teach your immune system to fight the real virus if it appears later. So who should get the vaccine? HPV infection usually happens during sexual contact. So the best time to vaccinate is before the start of sexual activity. That is why vaccination is recommended between 9 to 14 years for girls and boys. Don't worry if you missed it at a young age. The vaccination is recommended up to age 26. And if you are above 26 and below 45, you may still benefit from the vaccine, but you have to discuss this with your doctor. There are 3 types of HPV vaccines available. The bivalent vaccine protects against the 2 most dangerous types of HPV. The quadrivalent vaccine protects against 4 types, and the nonavalent vaccine protects against the 9 types of HPV. Most preferred is the 9-valent vaccine because it offers the broadest protection. So how many doses are needed? For those below 15 years, usually 2 doses are sufficient. First dose now and second dose 6 to 12 months later. For those above 15 years, 3 doses are needed. First dose now, second dose at 2 months and third dose at 6 months. Is the vaccine safe? Yes. Studies in millions of people have shown that it is very safe. You may get mild side effects like pain at the injection site or a mild fever. Does the vaccine work? Yes, in places where many people have been vaccinated, HPV and cervical cancer have dropped dramatically. For example, Australia is on its way to become the first country to eliminate cervical cancer. Now let me tell you some important points to remember. The vaccine prevents HPV infection. It cannot treat you if you are already infected. That is why vaccinating before exposure gives the best protection. But remember this, there are many types of HPV. Even if someone has been exposed to one HPV subtype, the vaccine can still protect against the other subtypes. Many people ask me this question, if I have been vaccinated, do I still need the pap smear? And the answer is a big yes. Vaccination does not remove the need for routine screening. So if you or your child have not been vaccinated, please speak to your doctor. And that brings us to the end of the video. Thank you so much for your time. If you liked the video, please share it with your family and friends. If you're new here, please check out my other videos and subscribe to the channel. We will meet again next week with another important topic. Until then, take care and stay healthy.